Okay guys, I just saw my last patient for the day, and now it's time to have my LASIK evaluation. We're going to do all the testing necessary so that we know exactly how to treat my eyes to give me the best possible vision. All right, let's do it.
Dr. Medert,
Yes.
come on back.
All right.
All right. So, my name is Doug. I'll be working with you before you see Dr. Wong today.
Okay.
And we're interested in LASIK today, so we'll get some diagnostic testing done. If you'll go ahead and have a seat right over here.
Yep.
Very good.
Thank you.
So this is the eye design. This is going to help us calculate the treatment for your LASIK. Blink a couple times and then open real big. You can blink normally. Open wide. There you go. All right, let's go to this one. I'll have you go ahead and take a seat in the exam chair. Can you read any of those?
No.
How about here?
I can guess NVA.
Okay. Any of those at all?
Yes, maybe? I don't know.
Anything there?
No.
All right, I'll have you go ahead and switch eyes. And can you read those?
FP?
How about here?
EDF?
Any of those or not so much?
Ooh, I don't know, CFEV?
Okay,
Guess.
that's all right.
How'd I do?
Yeah, you did all right.
All right, yeah. Sounds about right. That was cool.
How's it going?
Hey, hello, I know you.
Hey, hey.
Hey.
All right, tell me your backstory.
I've worn glasses or contacts, I think, since I was 17 years old. And I kind of got away with it for a little bit, and then I was fully dependent on glasses or contacts from like 20 onward. It wasn't so bad, but once I started working here, I realized how much better things could be. And so it's interesting because you actually taught me how to do LASIK. Now, I did a little bit of LASIK in residency. I was familiar with the procedure, risks, benefits, all that. But seeing the process, like how patients get worked up, which I just did with their help, and walking a patient from the beginning all the way to the end myself and seeing how happy they were, how high their quality of vision was, that like accumulated over the past couple years that I've been here into a tipping point for me where I just like woke up one morning and I said, I'm doing this. I mean, it's time. It's always a little scary, right? When you're gonna
What was the final straw?
I think you've talked about this yourself, like how eye doctors need to kind of be all in some ways. You had surgery on your eye. That's public knowledge, and it changed your life, I think. And you've mentioned that we go to meetings and stuff like that, and it's clear folks haven't had premium IOLs, they've not had LASIK, and assuming they have healthy eyes, the question is why not? And the more I did LASIK and the more I saw patients, the reason to why not got less and less and less. My biggest concern, I think, is dry eye. So I do have dry eye, and I've been using artificial tears since I moved to Texas, really. It's so dry here. Just normal over-the-counter teardrops. And then to get ready for LASIK, I did switch to serum tears to kind of just really boost my surface, make it as optimized as possible. And because I'm on serum tears, because I've seen what we tell patients is true, which is, yeah, you have some dry eye, it tends to kick up for the first few months and then get better, and go back to your baseline. I'm like, well, my baseline's not bad. I can just use drops twice a day.
Okay,
and
so
I'm okay.
Let's role play. Let's say you're wearing your soft contact lenses, which you wear some of the time.
Very rarely.
When you wear contacts, do your eyes feel drier or less dry than when you wear glasses?
I don't know if it's dryness I'm feeling or just discomfort. They don't feel good.
So your eyes are less comfortable wearing contacts?
For sure.
Your eyes are more comfortable wearing glasses?
Yes.
Okay, so let's say you're wearing glasses most days. How often do you feel like you need artificial tears, or do you even need them at all?
Well, I do what I tell my patients to do, which I like I said, I use teardrops twice a day, morning and night. And once I started doing that, I don't feel it during the day. But before that, when I first moved here, I think I would feel it every few hours. I'd feel like some dryness. But I wasn't using tears. It wasn't like I was like trying to save the day or rescue myself with drops. I just toughed it out.
You just used artificial tears morning and night, almost like you would brush your teeth.
Clockwork, yep.
Okay, it's not
Yeah.
because, or is it because your eyes feel dry?
They feel dry. It's
Okay.
just not. I wasn't actively treating it before, and it wasn't like I was doing it as needed. But once I started I just jumped straight to a schedule,
Fine.
and I was good.
Okay.
And then I switched to serum tears, mostly just because of this, just in anticipation of my measurements and everything.
Okay, got it. And serum tears are like ambrosia for the ocular surface. It really is the most powerful surface lubricant that we know of, and he just does it because he's an overachiever.
Yeah, I
Okay?
wouldn't say this is mandatory
Yeah.
for LASIK, by the way. If you're looking at this video, you're thinking about LASIK, I'm not going to say and promote that that's a mandatory thing you need to do, but for me, I just wanted to do it for myself. Yeah, walk us through what you're seeing there.
Okay,
and
so what I'm reviewing here is I look at your age, and how old are you, Max?
I'm 33.
And your refraction, and then we have an eye design, which is a wavefront measurement that I'm going to enter into the system.
While he's doing that, I want to talk a little bit about being 33. So when you get into your 40s, you're going to need reading glasses no matter what, whether you have LASIK or not. That's something I'm bearing in mind. It's something I bear in mind for all my patients. I always let them know, hey, if you get LASIK, things are going to change. And that's okay. It's just part of getting older. And that's a natural thing as you grow up. So anyway, LASIK is not like the cure to all eye problems. You'll get a cataract someday. Things can change. So keep getting eye exams.
Yeah, what I tell people is LASIK makes you normal for your age, and you keep aging normally thereafter. It doesn't keep you seeing the same age indefinitely. So if he's 33, you'll see like a normal-sighted 33-year-old after LASIK, but when he's 43, 53, he's going to have normal age-related visual degradation. Right, so let's look at your corneal topography. It's beautiful.
Thank you. Grew it myself.
I look at this topography and I say, that's a beautiful topography. All right, let's see here. Let's look at the pachymetry here. So the corneal thickness is normal. Intraocular pressure is acceptable given your pachymetry. Great. Let's check you out here. Better 1 or better 2, or about the same?
Very similar.
2 or 3?
Oh, way better with 2.
Okay, so let's try this.
Yeah, CVDTL.
I like it. All right, let's go to the other one. Make sure I got it. How's that look? Good?
Looks really good.
So lights are matched. That's good. It looks normal here. You getting that, Sarah?
Yes.
Toward my ear. That's really good. Normal. You got it, Megan?
Yes.
Sweet. And we'll take a quick look toward the back.
It's really not as uncomfortable as I thought it was for patients.
Yeah, it's really not.
It gets bright, but
This is bright. I'll dim it down.
it's not bad.
Got it. Okay, so that's all good. So,
I think that's just about it.
yeah, that's it. So you're a good candidate,
Thank you.
and you should do well. And when is your surgery scheduled for?
Tentatively, I mean, it's on the books for 3/28/2025.
March 28th. Today is March 12th. 16 days.
Yes, sir.
Got it.
Let's do it.
Got it.
See you soon.
Thank you, Max.
Yeah, thank you.
Yeah.
Appreciate it.
Good.
Bye, all.